foundation of orthopedic surgery really was to restore function for people. Orthopedics came out of general surgery realm, as all surgical subspecialties have, and it really started off looking more at taking care and specializing in fracture care was one of the foundations of it. And then the next thing that really started setting orthopedics apart was taking care of pediatric deformities, looking at the spine specifically. And then fast forward to really the 1950s and 60s, and the total joint as we know it today, whether it was a hip replacement or knee replacement, really started to come to fruition with the parts that we use, with the bearing surfaces that we use. And from the 1960s onwards, between the pediatric work we were doing and the joint replacement work and the trauma work, that cemented orthopedics as a field of its own.
Orthopedic surgery is a broad category. We probably operate on a wider range of things and treat, even non-surgically, a wider range of things than almost any other surgeons. If you throw in the spine surgery that some orthopedists do, it's everything other than the brain, the chest, and the abdomen. And so we take care of injuries like torn meniscus, torn ACLs, torn rotator cuffs, muscle conditions, joint conditions like arthritis. The surgeries we perform are generally to restore function and to relieve pain. And in arthritis surgery, when we're doing joint replacements, that's exactly the goal. Specifically, pain relief is the primary reason that we're performing these. But the side benefit is often correcting alignment and improving function in the process.
Surgery, the actual procedure is pretty brutal. It's pretty intense. You know, we open up the body completely, we expose all the things that we're looking at, and we look at what's broken and then we fix it and then put you back together, sew it back together. So that's actually a pretty involved process that needs to be done by someone who does it a lot. Because if you don't do it a lot, then you can make mistakes and not even recognize a mistake was made. There's generally significant blood loss with these bigger procedures like hip and knee replacement. There's quite a bit of pain. There's quite a bit of therapy and rehab and discomfort. It's not something, you can just have done and one day be normal again, right? It takes weeks to months, sometimes even years, especially with knee replacement. It can take up to 2 years to feel normal again. My goal for surgery is just to make you better than what you are, to alleviate your discomfort and to help you live a better life than you currently have. Most of the patients that come in to see me are in terrible pain. They can't do the things they love, and they want some degree of normalcy restored to their life, especially in their golden years, the time where they're supposed to be the best years of their life, and they end up being some of the worst because they're in so much pain they can't function. So to help them decrease their pain, to get them moving better, to get them enjoying the activities that they love to do.